Hi everybody. I am Dr. Soumita, working as a consultant neurologist at ILS Hospital, Howrah. So on 9th of February, it's World Epilepsy Day. Regarding epilepsy, I wanted to share a few informations with you people. That epilepsy is actually a seizure disorder where people or patients they suffer from some abnormal movements or maybe even sensations which occur to their body out of control and spontaneously. So these problems can remain limited to one part of the body or can be so diffuse as to cause loss of consciousness in that person. Now, this diagnosis of epilepsy is very important because even today it has remained a social taboo. People consider epilepsy to be sometimes ghostly phenomena. Even there are people who don't like to engage in marital relationship with people who have epilepsy. So it is important that the social taboo be cleared off as we can give proper treatment to the patients with epilepsy, and it is not at all true that this will cause problems with pregnancy or such people cannot enjoy a happy married life. So it is important to remove the social taboo, and it is also important for the patients to come up with their problems to seek medical care, because with proper treatment they can live a completely healthy life. Even they can even get rid of their epilepsy or seizure disorder in due course. And also the caregiver should know about how to give proper treatment to these patients so that when the attacks occur they don't suffer that much of physical injuries, or mental injuries also they can get rid of. Now this to describe the illness, as I have already told, it is an abnormal sensation or it's an abnormal movement or something which is occurring spontaneously. It is out of control, and at that point of time it can become more generalized. It can spread throughout the body and can make the person lose the ability to stand upright or sit upright, and even that person can become unconscious. There can be associated breathing difficulties, there can be associated physical injuries because of the abnormal movements. And the sensations which occur, they can be related to touch, means tactile sensations, some amount of funny sensations, feelings. It can be associated with eyesight, seeing abnormal things in front of the eyes. It can be associated with auditory phenomena, senses like hearing abnormal sounds. Anything can happen, or it can even be an abnormal behavior. So diagnosis is very important. If something like this is happening to somebody, some person, again and again, is staying transiently for some time, during which period the person may remain conscious but is not being able to control that, or is unconscious, and just when the phenomenon is over, that person even forgets or denies that anything like that happened to him or her, then these things can be probable seizures, and the person or the caregiver or the relative should seek medical care for the diagnosis and proper treatment of this. Now, during the last half of this 19th century or this early 2000, there has been so many new anti-epileptic drugs in the market. So treating epilepsy is not at all a big problem nowadays. Even after giving treatment, 1/3 of the patients may continue to have intermittent seizures, which we call breakthrough seizures, but that can also be well treated. And if the person is not responding to medicine, there are advancements in surgery where we can remove the affected part of the brain which is diseased, which is causing the seizure to occur. We can remove that part, or we can even go for some other advanced surgeries, some implantations inside the brain like DBS, deep brain stimulation, or there is something called RNS, there is something called VNS. These are all stimulatory devices which can be implanted. They will help to control the seizures in intractable cases. So when there has been so much of medical and surgical advancements in the treatment of epilepsy, I think people should come forward. They should seek medical attention as and when appropriate, and I think epilepsy can be removed from as a social taboo, and people with epilepsy can enjoy perfectly normal life like other people without epilepsy. For the patients who are seeking treatment for epilepsy, some things are important to know, like they have to take their medicines regularly on time. Secondly, there are some factors which can cause precipitation of these seizures, like sleep deprivation, stress. There are some medications also which can reduce the seizure threshold, means increase the propensity for the seizures to occur. So these things can be avoided if they are informed about them. And third, that if somebody is expecting pregnancy, then some adjustments in medications are required, because many of the anti-epileptic medications can cause damages, developmental defects in the baby. So at that time, definitely before conceiving, they should contact doctors and make those necessary adjustments or changes in their drugs. This question also we commonly face, like if a child is suddenly diagnosed with this epilepsy, then the parents' questions are like, how long is the child going to be on treatment? So in that case, it depends totally upon the diagnosis, the underlying cause, why the child is or the patient is having this epilepsy. If it is some structural damage, like there is some diseased brain which occurred due to birth defect, or if it is like there is some tumor in the brain, anything like that. So for those structural problems, usually the treatment is long term. Maybe the person will have to take treatment for many years or maybe lifelong. But if it is a genetic epilepsy, some syndrome, then there are many which can be cured gradually as the child grows up. There are many which can even aggravate as the child grows up. So that varies from syndrome to syndrome. But otherwise, where we are not getting to find any exact diagnosis, where the imaging is also normal and there is no such genetic problem, then once we start medications, we usually continue it for 3 to 5 years. And if in that period there is no recurrence, we can give a trial of tapering off or stopping the medications. And another thing, that the patients who are taking medications for seizure, they should maintain a seizure diary, because so when a person comes up with a seizure like episode, like symptom, we go for diagnostic investigations like brain imaging, where we have to find out whether there is any underlying problem inside the brain, which can be treated in other different ways. Like it may be infection which is transient, which can be treated with antibiotics and all this, or it's some structural problem like tumor, which can be treated with surgery, or some birth defect which is not possible to treat, but the patient will need long-term treatment. And we also go for some electroencephalogram, which actually gives us an idea whether the patient is having, means if we find abnormal activities there, then it confirms the diagnosis. But the thing is, EEG is a 10 minutes to 30 minutes graph. It's that duration test. So if the patient doesn't have any seizure during that time, then EEG may appear to be completely normal, but that doesn't rule out the diagnosis of seizure. So once we start the medication in that patient, then how can we be sure that the patient has been adequately treated with the medicine? For that, what we do is that we ask the patient to maintain a seizure diary. In that case, if the patient knows what all are the symptoms of the seizure that he or she experiences, and if those symptoms are occurring, it may happen that the symptoms occur in series and all the symptoms are not occurring, but only part of that are occurring, like which we call truncated seizures. Then those episodes will help us know whether the patient has been adequately treated with medicine, whether we need to increase the dose of the medicine or not. And not only that, the seizure diary also gives us an idea regarding the timing of these seizures. Like if somebody has seizures during the menstrual period, which we call catamenial epilepsy, there is also different treatment for that. So seizure diary maintenance is also very important. And the seizure patient caregiver, they also need to be educated that if seizures occur to these patients, then what all things they should do and what all things they should not. Like the patient should be made to lie down, and they should not restrain the patient, but yes, they can protect them so that they don't get injured from the abnormal movements. They should make the patient lie on one side so that the secretions which collect in the mouth, due to the effect of gravity, those secretions come out and don't get into the respiratory tract, breathing tract. They should not insert anything inside the mouth because that can cause further injuries. Okay, and the caregiver, and if the caregiver finds that these seizures or these unconscious periods are lasting more than 5 minutes, or there are repeated seizures, like one seizure over before 5 minutes, but another episode sets in quickly, then in those cases they can use some emergency medications, seizure aborting medications, which are available very commonly here in the form of nasal spray, and that dose they need to know from the medical practitioner, and in appropriate dose they can give those medications to abort seizure on emergency. And so it is very important to break down the social taboo associated with epilepsy. Any person who is suffering from the symptoms like seizures, they should always seek medical care, and their relatives also should support them. ILS Howrah is 24/7 at your service.